Hello, I'm Dr. Michael Teplitsky. I'm a medical doctor practicing internal medicine and alternative holistic medicine in New York for over 30 years. This is part two of our series about thyroid, low thyroid. Lots and lots of people, millions, in fact, suffer from low thyroid and they do not get the right help. And last time we talked about what are the symptoms of low thyroid. They have to do with the fact that the cells of the body do not get the energy they need. So the person feels tired and sluggish and feels colder than other people. There's dry skin, depression, and memory loss, and constipation, and many other things. Today, I want to talk about why this happens. Why do people get low thyroid? And of course, just to repeat, low thyroid happens when your thyroid gland doesn't make enough thyroid hormone. So there are two main reasons why that happens. Reason number one is called autoimmune thyroiditis, or Hashimoto's disease. Hashimoto was a guy who described it. So what happens is your immune system starts attacking your own thyroid gland and slowly destroys the cells of the thyroid. So eventually you don't have enough gland to make enough hormone. So you become low. That makes sense, right? The reason number two, which most people don't know, is that you need iodine to make thyroid hormone. Just like you need iron to make hemoglobin in the red cells. So there are two types of thyroid hormones. T4 has 4 iodines, T3 has 3, and so you need iodine to make these hormones. But if there isn't enough iodine, then you can't do that, and that's how you become deficient. Now, where do we find iodine? We find it in the soil, and we find it in the ocean. So people who eat a lot of seaweed, like kelp, like Japanese people, they get plenty of iodine. But unfortunately, in the United States, in this country, we do not get enough iodine. And in fact, there is such a widespread deficiency of iodine that in 1924, the US government has decided to add iodine to salt. That's why you have iodinized salt. Because they figured, well, everybody uses salt, so we'll throw in some iodine and people will get it this way. Of course, these days, many people don't use salt because we're told that it's not healthy. But the point is that there are a lot of areas in the United States where there isn't enough iodine in the soil. So when people eat local food, they do not get enough iodine. And it turns out that you don't only need iodine to make thyroid hormones, you need iodine for normal function of the brain, of the heart, of the lungs, and other organs. And women especially need a lot of iodine for normal breast health. So when girls go through puberty and develop breasts, those breasts steal all the iodine that's available, and very often that's not enough. That's why American women have so many breast problems. Many women have fibrocystic breast disease with painful hard lumps in their breasts, breast cancer, of course. And in Japan, for instance, that I mentioned, where they eat a lot of iodine, this is virtually unknown. So the point is that you have to have iodine to make thyroid hormone. If you don't have enough iodine, you will not be able to do it, so you will be low. And this is another reason for low thyroid. And this, incidentally, is the reason why hypothyroidism or low thyroid is primarily the disease of women. For every man who has low thyroid, there are about 8, 9, 10 women who have it. So that's why I have devoted a lot of time to this problem. I've treated literally tens of thousands of women with low thyroid over the years. And what I find is that many women have the symptoms of low thyroid. They go to their doctor and they check the blood test, and the blood tests are normal, which I'll talk about in the next part of this series. But for right now, I can just tell you that if you have a problem with low thyroid, if you think you have low thyroid, call my office, 718-769-0997, 718-769-0997. I do private consultations with people all over the country, in fact, all over the world. And if necessary, we can do whatever blood tests we need and decide what treatment you require. So again, 718-769-0997. Don't forget to tune in for the next part, which is part 3. We'll talk about the diagnosis. And then, of course, part 4 will be about the treatment. I'm Dr. Michael Teplitsky, wishing you the best of health.